This is Health Care Reinvented, where we explore the intersection of healthcare and technology in Pittsburgh. I'm your host, Jonathan Kirsting of the Pittsburgh Technology Council and Tech 5 Radio, ready to bring you these amazing stories with Highmark. In today's episode, we will explore the new CopayGo healthcare plan, an innovative solution by Highmark aimed at making healthcare more accessible and affordable. I'm excited to welcome Highmark's Jonathan Majernik, who is Vice President of National Accounts, and Taylor Mackay, who is Strategy Partner, as they discuss and introduce CopayGo. It's a simplified, transparent healthcare plan that's going to be launching on January 1st, 2026. They're going to delve into the motivations behind the plan, its key components, its benefits design, the network, enhanced digital experience, and so much more, all in aiming to address rising medical costs and providing a better healthcare experience. Learn how this revolutionary approach could transform the healthcare landscape by providing predictability and ease for both employers and members. Let's welcome Jonathan and Taylor to the show. So Jonathan and Taylor, I am so happy to have you guys hanging out with me in the Huntington Bank studios where we do Healthcare Reinvented. We have the most awesome conversations about the intersections of technology and healthcare here. And I tell you what, this CopayGo solution has me really excited. Just the idea of giving more accessibility and affordability to the awesome services that Highmark has, to me, is very exciting. But before we jump into that, I got to know about you guys first. And so, Jonathan, since we share a common name here, I'm going to start with you. Tell me about yourself and what you do with Highmark.
Absolutely. Thank you, Jonathan, and thrilled to be here as well. So, Jonathan Majernik, I am the Vice President of National Accounts at Highmark. Just clocked in 24 years and
Wow.
really excited to be here today. I lead a team of client managers. And so, my role and for my team and I is to support national account employers, help them manage their claims trend, help them support their employees live their best life. And that is how we can address areas of risk, cost, and condition prevalence. And CopayGo is the perfect solution because our role is to make strategic recommendations to support them in their benefit and healthcare decision making. And again, really excited to be here today.
Yeah. First off, 24 years is an amazing stat because that shows you love what you're doing, which I think is great. So you got the passion to make that happen. That's what makes, I think, Highmark so special, is the fact that so many folks like you are bringing this passion to what you do. And that's what gives that extra bubbliness when it comes to making sure people get some of the best care. So
Absolutely.
Taylor, you got to tell me about yourself. Now, if you
Yeah,
got more than 24 years than Jonathan over there, then we're going to have a super celebration. So,
yeah. I should probably lead with my years. I just hit 3, so nowhere
excellent. That's
near
good.
what
You're on the
Jonathan's
way.
accrued. My title is a bit nebulous. It's strategy partner. My work is specifically in commercial product strategy. So really working with Jonathan and other sales leaders in order to make sure that we have innovative and interesting products that both employers and members are interested in using. Our focus at the moment is really in simplicity as well as addressing things like health literacy. So those two kind of go hand in hand, right? Making
Sure.
sure that healthcare and health plan designs that traditionally are relatively complex are simplified in a way that makes it easier for people to understand and subsequently use those benefits in a way that drives value.
Yeah. Simplification is just so important because the idea, it can be so overwhelming, especially when you're dealing with healthcare stuff and your health's on the line, and it can be confusing. And to make things simple and addressable, I think just makes it all the more effective. And let's just jump in. Give our listeners this overview of what CopayGo is going to do when you guys launch this thing out next year. And when is the official launch? It is 2026 when this
Yeah.
comes out. Yeah.
Correct?
That's exactly right, Jonathan. So January 1st, 2026. And I'd love to kick off maybe with the
Surely.
why and sort of the
Yeah, I mean,
problem
that's the
statement,
best way to go. Because I mean, there's a
and
reason why you're doing this, and
exactly.
that
And,
it tells us a lot for
and
sure.
I think it comes back honestly to the current healthcare landscape. Quite
Hmm.
frankly, the medical costs that we're seeing are just unsustainable, for our employers, and that naturally trickles down to the members that we serve as a result. I just saw a recent McKinsey study. They're projecting 9 to 10% annual commercial cost growth through 2026. as I'm meeting with my national account customers, I'm seeing that. I'm seeing medical year-over-year trends in the low to mid-teens. It's unsustainable, and our employers need help. And there's a lot of reasons for that, right? We
Oh
talked
yeah.
about GLP-1s, we talked about specialty, claims, we talked about high cost claims. And, there is still that, pent-up demand from the early pandemic years. There's elective procedures, the preventive screenings that got delayed or skipped. We're still seeing those come through that are bringing some additional, costs into the system. And what I'm excited is that CopayGo is what our employers need. It's bold, it's innovative, it's exciting, and I think it addresses what this inherent need is. I'm going to let Taylor here in a moment really
Yeah,
kind of give that
sure.
first pass, but I think what I'm excited for, as Taylor pointed out in his introduction, it is based in simplicity and in the benefit design. It allows for a level of predictability and a level of confidence for our members to have in cost for procedures and their cost share. It taps into real-time transparency and that data that we've really never had, and ultimately is wrapped around a really cool, sophisticated member digital experience that we're super excited for. So Taylor, maybe you can take a little click down and walk
Keep us going,
through,
man.
yeah,
Yeah, sure thing.
the CopayGo itself, if you wouldn't mind.
So taking a big step back, I'm gonna use something that a colleague of mine says about CopayGo, thinking of it as a stool, right? There's three legs to that stool, three key components of it, and then wanted to kind of dive into each of those components to provide some context as to what exactly we're doing with CopayGo. So those three legs, right? It's going to be benefit design, it's going to be network, and it's going to be enhanced digital experience. So at its simplest form, CopayGo is a copay-only plan with a national provider network. Getting back to what was mentioned earlier about health literacy, right, and trying to create simplified plans, what we've done through a variety of different research, we've identified some of those complex elements associated with benefit design, namely deductibles and coinsurance. And in order to better empower members, we have removed those. We've eliminated them so members will have first dollar coverage and improve transparency through that copay only design. The hope is that that helps empower them and helps them easily know before they go and get that care how much something is going to cost. Getting back to how we shop around today, that's a huge benefit and a huge need, right? You need to know how much something is going to cost before you can make a decision and feel confident with that decision. One of the things with regards to the network, which was another leg of that stool, right,
Yes.
is that we're looking at a national network. And unlike a narrow network that eliminates the number of options that might be available to a member, CopayGo takes a different approach, right? So we're looking at tiering 20 high impact specialties that does include primary care. So this means basically those providers that were in the network to begin with will continue to be there, but through the tiering, what we're doing is we're helping members better identify those high value care options. And you might be wondering, like, why are we focusing on those 20 high impact specialties? Well, the reality is those providers sit at a very pivotal point in the member journey. They're not only impacting the care that they're going to be delivered in their office, but they're going to be impacting all that care that's being delivered downstream. And as a result of where they sit in that member journey and the care that is managed through them, that actually accounts for about 60% of medical spend.
Wow.
So
Okay,
by
that makes
focusing on
total
those,
sense. That's where you're going with this because that just
yeah.
it's a
So
big chunk right there. Yeah, I
by
love that.
focusing on those impacts, high impact specialties, you're able to manage a very significant portion of the medical spend. And then to complement the design, right, that third leg of the stool, we've made several enhancements to My Highmark, right, which is the website, the app that our members are going to be using in order to better understand their benefits and then also identify care options, compare costs, make those decisions about what's the next step they're going to take in their healthcare journey.
This is just very exciting to me because this is working on so many different levels. It's almost hard for my brain to unwrap all this, but I'll try my best because what has me most excited about this, first and foremost, it's obviously the person who's using it, right? As someone who's looking for care, you're making something that's transparent, that seems like it's very simple to understand and gives you the best options where you're going to need it the most in the wide network, which just seems perfecto to me. A lot of these things you see where you're put into a very narrow band and it kind of limits what you can do. This doesn't do that. But then I think about from the employer standpoint as well, too, this is going to provide some predictability on costs. And as Jonathan mentioned earlier, a way to address the fact that we're seeing these increases. It makes it really tough as a business to operate, to know that every year they're going to be hit with a new set of costs and how they're going to deal with it. So I believe it alleviates stress on both sides of
That's
the
right.
equation, which to me is amazing. And I feel like this is like the start of something really big for Highmark, because this is something that, this is shaking some trees, and
Right.
probably there might be some helicopters circling around the headquarters there wondering what's going on. So I would love to talk a bit about some of the provider tiers that you were mentioning. The idea that, tell me how this kind of works out across, this whole platform.
Yeah. So those 20 high impact specialties, right?
Yeah.
What we're doing is we're leveraging the most comprehensive data set in the industry. It's called the Blues National Provider Performance Data Set. And that data set has 3 key data points that we are using to tier, right? First, cost, right? How well are providers managing the total cost of care of a patient? That is going to be inclusive of all the healthcare spend that's happening during a medical episode, right? So think of a surgery, for example. Not only is that surgery a cost, but all the stuff leading up to it, imaging, labs, and all the stuff
Right.
on the back end, any subsequent follow-ups, any follow-up imaging, any sort of physical therapy that might be associated. Next up is quality, right? How well is that provider avoiding complications? Are they following care guidelines? And then lastly, this is something that's unique to the Blues, appropriateness. And so this data point looks at how well is a provider using evidence-based decision making in order to eliminate unnecessary or low-value care. And so while I'm not going to get into the nitty-gritty of the formula of how we're doing the tiering, at a high level, what we're doing with this data is we're establishing cut points, right? Where we see a provider scoring, whether it's cost, quality, or appropriateness, above average or poorly. And then we weight that in order to place providers in their respective tiers, those tiers being enhanced, right? So
Okay.
those providers really practicing at the top of their license, or standard. And again, the great thing about tiering is that it doesn't eliminate options for members, but what it does is it helps inform them and educate them on how they might be able to choose that higher value option.
Yeah. And this is like something that's never been available before. So as people are navigating this, I think it's going to open their eyes and, like I said, simplify things, and maybe take some of the fear out of some of it as
Yep.
well, too, just because you really understand like where it's all kind of coming from. So, I mean, obviously, I just feel like the benefits that could come out of this are just tremendous. And I'm also assuming that as this is your first iteration launching this thing out, that as this thing progresses, you're going to be able to tweak and maneuver as things go. I mean, any kind of initial expectations that you're kind of hoping for as to some of the benefits that people will see with this new approach that you guys have?
Yeah, thinking about the benefits that a member might have, it all boils down to a single word, right? It's transparency.
Yeah.
And that transparency, it's important in every industry. I'll say it, right? But in
Sure.
healthcare, it's critical, right? If you look outside of our industry, you have a company called Amazon, which I'm sure you're familiar with.
I've heard of
They're
that someplace before. Yeah.
they're a great example of an organization that uses data in order to deliver transparency that empowers consumers. And so if you're able to hop on Amazon, what you can do, you can perform a search, you're going to receive relevant results, you're going to obtain costs, you're going to understand quality through reviews, and all of that's going to help you understand what you want to purchase. You're going to be able to know cost and quality before you click that buy button. And really the goal here is to get healthcare in a similar place. We believe healthcare should be the exact same experience. With CopayGo, the idea is that the enhanced provider search that we've created through my Highmark, right? That's going to allow members to make a search for a specific care type or provider type. They're going to be receiving transparent cost information thanks to the copay-only design, right? It eliminates some of those complex elements that make it difficult to determine your cost share, eliminates the deductibles, eliminates the co-insurance. And then through understanding the cost, they can further gauge value by looking at that provider tiering. Am I looking at an enhanced provider? Am I looking at a standard provider? What's the cost associated with each? And then by understanding the value of their care decisions, they're going to be savvier users of the healthcare system and have that same confidence in the choices that they're making in the healthcare space as the confidence that they might have in the retail space or the hospitality sector
Yeah.
as they're using those same tools.
Yeah. And,
Sure.
and if I could, Jonathan,
Great,
As we
please.
think about cost transparency,
Yeah.
I want to take us back, that's 20 years.
Okay.
So going back to January 1st, 2004, it was the first year a qualified high deductible health plan was
Okay.
ever launched. And so I go back and, the original concept, right, was that higher deductibles would, to some degree, force, but also encourage members to shop for value. And I think what we're seeing 20 years later is that never necessarily came to fruition. One, I don't think that the tools were sophisticated enough to support that approach. And I think what we ultimately saw as an outcome was that members were actually using less care across the board. Yes, we saw some savings through qualified plans, but was it because we made better healthcare consumers? No. It actually caused, in my opinion, greater long-term negative outcomes. We saw a decrease in utilization and care that members needed. And these are things like preventive care screenings, recommended
Yes.
immunizations, diagnostic
Right.
testing. It was counterproductive to what was supposed to happen. And so I think the power of CopayGo, leveraging everything that Taylor just shared, that transparency, the member engagement tools, that national network, looking at cost, quality, and appropriateness, it accomplishes a lot of what the intent of qualified HDHP plans were 20 plus years ago. And so that's why I'm really excited. I think it carries forward using, just as Taylor pointed out, sophisticated, the innovation we've been able to develop at Highmark, the really sophisticated and easy to use member engagement tools. We're now able to accomplish what was initially intended, with the qualified high deductible health plan launch.
You must be like reading my mind or something, Jonathan, because I'm serious because just before you started, giving us, that's where my brain was going to the fact that as you roll out CopayGo, it becomes more transparent as the things you can actually have done. I think a lot of times when we have our stuff, the high deductible stuff, it's like, you're not even looking to spend money for lack
That's
of a
right.
better term. Like you're just trying to save. Whereas this kind of flips it around and you can actually see this is what's available. And people, I think, would be really surprised to know that, oh my goodness, I didn't realize this stuff is actually covered and I can actually afford it. And now I can actually see what it's going to cost and everything like that. So I feel like this is like I guess it was like 20 years in the making to get to this point. But I think in many ways, like,
That's right.
the technology now is allowing that. So I think we're on the precipice of some pretty exciting stuff as we roll out to 2026 with this thing.
That's
And
right.
I think a lot of it's going to hinge upon the digital experience, which I know is something that Highmark has done really well over the years. We've seen some of your engagement through some of your apps, and people, they kind of glam onto them and they are able to use them. Tell me about the digital experience and how this is really like the hub in order to make the CopayGo work properly.
Yeah, the digital experience is something that I get really excited about. We have great partners in the digital experience team. We've been working lockstep with them in order to make sure that everything that we're doing in the benefit design, the product side of things is being reflected and enhanced and empowered through that digital experience. Because the reality is when you're creating a product like CopayGo that promotes that shopping around for care, digital tools become critical in the same way that the Amazon app or website becomes critical in members being able to shop around for, mugs, pens, whatever it is that they're looking for. So similarly, we have heavily invested in the digital space and those digital capabilities in order to allow members to take advantage of that simplified cost share, and then also allow them to navigate that tiered network. So some of the tools that we're leveraging are going to be discussed a little bit later, but I did want to kind of highlight one of the things that we're doing from day one, right? So the
Yeah.
first time that a member logs on to my Highmark, they're going to be presented with a unique onboarding experience. And I think so far throughout this conversation, we've been able to recognize that CopayGo is different than a traditional plan. And so what's important is that we take a moment to educate that member on their plan design, on the benefits that are available to them, and the tools at their disposal that allow them to identify options and costs associated with the care that they're looking for. In doing so, then we're able to better extract the value that we're trying to create through CopayGo. So in addition to making the cost of commonly sought after services more readily available on that member splash page, there's been a significant number of enhancements to the chatbot and the provider search. So the chatbot, for example, it's going to engage with members by name. in addition to answering any benefit questions that they might have, and then helping them take that next step, right? In addition to telling them what that cost might be with an enhanced provider or a standard provider, it's going to help connect them to their options, those options that are available near them. And then from a provider search standpoint, that's undergone a significant overhaul. Idea being that we want to mirror the experience that you might have in retail and hospitality, allowing members to better identify and compare care options near them.
I tell you what, it seems like it's almost having a digital assistant as to help you walk yourself through this,
That's
like a
right.
little
Exactly right.
concierge service going
Yep.
on.
You're right. You're right. And as much as I'd love to think, Jonathan, that our members are waking up Sunday morning, having a cup of coffee, thinking, "Yeah, let me check out what's new with the Highmark app." I
Like,
mean, the reality is,
what test
you
would I
know,
like to get next week?
exactly. The reality is, members reach into us when they need us. Either they've have a healthcare need, they've been maybe having a baby, or they've been diagnosed with a new condition from their specialist, and they're scared, or they need help. And just to reiterate to what Taylor said, we've spent the last few years making significant investments to simplify the digital experience. We were guilty, like many other carriers, of having what I would characterize a fragmented app fatigue, various
Really?
kind of places. And we simplified that. We consolidated that. Everything is now through my Highmark, and CopayGo's is no different. There's not a separate app. There's not a separate digital experience. That same user ID that the members have today will be the same one they use tomorrow in CopayGo. And it just reinforces that narrative of simplification and having those tools right at their fingertips. So again, we're just so excited to see this continued
Yeah.
evolution of that digital ecosystem and experience at Highmark.
It just seems like such a tremendous lift to make this happen. I'm just curious, like, when did work begin on this thing? When was day one? We're like, we're doing this thing,
No, like many
we're making it
times,
happen.
Jonathan, we are our own guinea pig. So we actually have gone live January 1st of 2025
Mhm.
for sort of the house account, if you will. So Highmark employees. We
Nice.
shifted our benefit plan designs and eliminated an EPO and replaced it with our own copay plan and offered it to employees this year. So we've got a big section of our own employees utilizing the experience today, working out some of
Very
those
cool.
kinks,
I love that.
and
Yes.
making sure we're ready to go live. So we're already in there, which has been great.
That's pretty awesome. So obviously when this thing goes live for the whole public on January 1st, 2026, which you say 2026, I'm like, that's never going to happen. Oh my God. Yeah, that's like, we're only a few months out. Oh my goodness. I absolutely love that. And so, I mean, just as we kind of like wrap this thing up, I'm thinking as this thing launches, you're just expecting, we've kind of come through all these improvements that we're going to see. We're going to see folks that can actually find care more easily. They can be more proactive in their care. They can know what it's going to cost. Like, what if I missed here? I feel like there's just so much going on that I'm just giving you this kind of like a quick synopsis. It just seems like there's some really great stuff that we can all look forward to as this rolls out.
Yeah, I might
Yeah.
call out, Jonathan, that
Yeah.
something that I'm passionate about is around sort of the analogy of all ships rise, right? We're going to have the various tiers based on the level of cost, quality, and appropriateness through what Taylor described in terms of that national provider data set that we're leveraging from the Blue Cross and Blue Shield Association. So this is a national solution. And what I'm excited for, and I think back to what we've done just within Highmark's core footprint through our value-based program called True Performance. And since 2017, this is a program that incentivizes physicians based on those same characteristics: cost, quality, and appropriateness. And we've achieved over $4 billion in avoided costs. And providers in the program receive those regular actionable data insights. And I think CopayGo is aligned with that philosophy, that we're supporting providers across all of their performance levels. We want everyone to rise together. And I think that if a physician is in that standard tier and want to get to that enhanced tier, we're going to have that ladder. We're going to be able to support them in how to improve in those metrics, the cost, quality, and appropriateness, so that they can, achieve. And that just makes the whole healthcare system better as a result. And so that's the piece that, as we think
100%.
about
Yeah.
the impact from a provider and physician and how we partner, is something that I'm super excited for.
You have me excited, that's for sure, because at Council, we see how our members, like, healthcare is one of the most top concerns that they have for providing the best for their employees. That's how they attract and retain talent. And we want to see people happy and alive and healthy and all that. So this just feels like a remarkable new step. And I'm really excited for what's going to be happening next. I'm looking forward to having some follow-up conversations as this rolls out, because obviously you'll be collecting more data. You're going to see how people are using it, and you're infinitely always tweaking it and making it better. So that, to me, I feel like this is a big first step. Very excited for you guys at Highmark, that's for sure.
Absolutely. Appreciate that.
What a fantastic conversation. I really can't thank you enough for taking the time to hang out with me. Jonathan and Taylor, you guys are the best, making Highmark proud over there. And at the Tech Council, we love having these conversations. Doing Healthcare Reinvented is something that we get really stoked about, because we see firsthand what happens when tech and healthcare intersect. Great things happen, just like CopayGo. So thanks for joining us here today. Keep on following us. Once again, this has been Jonathan Kirsting with the Pittsburgh Technology Council.